met in the year 2000 and were married in 2001. We have 3 children. Jevin will be 6 in about a month. Ashton just turned 3, and Erilyn now is about 10 weeks. I was due on a Saturday, March 10th, and March 10th came and went and started getting anxious, as most pregnant women do, because you are mentally and physically ready to have this baby. So then we decided on that Friday that Dr. Richards would try inducing me.
And so then she came to see me, and she was almost a week overdue, and we had her come in and gave her medicine to get the delivery, get her labor started. Not too much happened, so we gave her a second dose. A little bit more started to happen, so then in the afternoon, kind of late afternoon, I broke her water.
And actually, Erilyn was born about 2 hours and 20 minutes later, so it went really fast after she broke my water.
I think what makes the delivery at Richland Hospital a little bit different than maybe delivering in a big city is that it's still very family practice oriented, meaning it's like very focused on the family. When you go into labor, they call your doctor, and whether it's the weekend or it's the night or whenever it is, your doctor comes in and does the delivery. But also, I think that it is, on a very personal level, very satisfying, both for the patient and for the doctor, because you both have been waiting 9 months, to see, well, what will it be like? So the whole kind of mystery of what happens as far as when it happens and how it goes, you both are looking forward to that.
One of the things that I enjoyed about the hospital was that they were there to get to know me and to talk to me and help keep me awake, and were there anytime that I needed anything, whether it was some ibuprofen for pain, or if I wanted to see the baby, they would bring her in, or whatever it may be. A lot of personal, individualized care, and I really appreciated that.
Back in April of 2002, my son and I had gone to Madison because he was going to have an indoor soccer game. And before the soccer game, I had wanted to run over to a bookstore and grab a couple of books that I was interested in. And in doing that, I took a little longer than I had intended, and we were running close to his time for his soccer game. So I came out of the bookstore, and just as I did that, there was a small lip on the edge of the sidewalk going to the street, and I hit that with my foot, and that's when I went airborne. And not knowing how to come down properly to save my body, unfortunately my knee was the first thing to land. I went through the weekend with the pain. I took lots of pain medicine and tried making it through all day Sunday, and I stayed around the house. And Monday morning right away, I drove myself over to the hospital.
When he came into the office, what we could tell is that he had a complete inability to straighten his leg out. And right there, I knew that there was something significant other than just falling and bumping your kneecap, which in most falls, that's all that happens. So it was pretty easy to tell from looking at him in the office that he had broken his kneecap. And then we took x-rays that day, and it confirmed that he completely split the kneecap in half.
When it came time to have the surgery for my knee, I had to make a decision because it was a very serious accident, and I knew the results of that could possibly go with me throughout the rest of my life. So I had to make a decision, number one, that I wanted to get the best quality care I could get, and that meant that I wanted to make sure that the surgeon I had doing my surgery was the best. I wanted to make sure that the hospital that took care of me after my surgery would be the best. I had to go through an extensive physical therapy, and everything really went well, and the staff, every one of them in all the departments were just excellent with the quality of care they gave me, and they really made me feel like I was their #1 patient when they were giving me the care that I needed, and I'll be deeply indebted to them forever.
Bob was born here at the Richland Hospital. He was an attorney for 50 years, and he didn't miss many details until the last several years, and we noticed things were beginning to slip past him. His driving skills deteriorated, and he was diagnosed with Alzheimer's disease as well as Parkinson's. Bob had spiked a fever on a Friday, I believe it was the 15th of December, and the whole world was gearing up for Christmas.
When Mr. Keegan was admitted to the hospital, he came in because he had a fever, but then had a series of other problems that developed during the week when he was at the hospital. It was quite a roller coaster ride for his family as different complications arose and as his condition changed.
It took me by surprise because I thought, you know, we got through all these other little crises, it'll happen again. But this time it was different.
I remember thinking that Bob, this was probably going to be one of his last days. Of course, we never know for sure how long they have. And I remember thinking, I'm not sure they are fully aware that this could be one of the last few days that Bob has here.
Lisa kind of looked at me and she said, "Oh, Nancy, I think we need to talk to Dr. Smith. I think it's time for you and your doctor and your family to sit down and talk about this." And I think the realization, just by her gentle way of telling me, I thought, oh, I think we're looking at something a little more serious than what I had thought. They basically told me that Bob's system was closing down and we needed to just go with that. You know when the end is getting a little closer because of the irregular breathing and things, but you're still not sure, and you just watch, and you almost want to breathe for them, and then he took his last breath, and the nurse arrived and listened, and she shook her head and she said, "He's gone." I felt this arm around my shoulder, and Dr. Smith held me in his arms and just let me know that it was good. It was good. It was good.
It really was, quite a touching scene because so many of the family were there and so many of the staff were there, and that everyone was really giving mutual support.
The presence of that hospital in our community is priceless. They knew the hurt we were living through, and they did their utmost to be sensitive to that. We're extremely blessed to have them.